Hello and welcome to this episode of STEM Chat with Julia. We are thrilled to have you tuning in. Right before we get started, we want to remind you that STEM Chat with Julia aims to demystify topics in STEM by staying up to date with the latest advancements in science, technology, engineering, mathematics, and medicine by talking to specialists in the respective fields who can provide answers to our questions. Julia and Alicia are presently not licensed medical professionals. We are here to learn alongside our community from professionals in order to have a better understanding of the presented topics and share the knowledge with you all. On this note, enjoy the episode. Hi everybody and welcome to another episode of STEM Chat with Julia. We are your hosts. My name is Alicia.
And I'm Julia.
And today we are honored to be joined by the esteemed Dr. Iskandar, a true titan in the field of mental health.
With a storied career as a former medical director of Psychiatric Intensive Care at the renowned Douglas Institute, Dr. Iskandar's expertise spans decades of groundbreaking research in schizophrenia, antipsychotics, antidepressants, and mood disorders.
And not to mention his tenure as a former assistant professor at McGill University's esteemed Department of Psychiatry speaks volumes about his contributions to academia.
With over 35 years of invaluable experience, Dr. Iskandar, thank you sincerely for gracing us with your presence at STEM Chat.
It's a pleasure to be here.
So we're here today to talk about insomnia. So what is insomnia, Dr. Iskandar?
Well, insomnia is a common sleep disorder that can make it hard to fall asleep or to stay asleep. It also can cause you to wake up too early and not to be able to get back to sleep. You may still feel tired when you wake up, and insomnia can drain your energy level and affect your mood. It also can affect your health, work performance, and quality of life. At some point, some adults have short-term insomnia. This can last a few days or weeks, but short-term insomnia is usually due to stress or distressing events around, but some people also have long-term insomnia, what we call chronic insomnia, because this lasts for 3 months or more. Insomnia may be the main problem, or it may be related to other medical conditions or medicines.
Mm-hmm. And so why is it that sleep is so crucial, so important? Why do we need
good
sleep?
question.
Everybody is asking, why we have to sleep? Yes, we need to sleep because the body, it remains, first of all, a biological enigma. We don't know exactly why we sleep. But for sure, we have a lot of theories that were experienced on some animals. For example, sleep deprivation studies in animals. Severe, prolonged, forced sleep deprivation leads to sepsis, means infections, and death. So this is in animals, that some studies were done on that. And sleep affects all the organs of the body. During our sleep, there are some hormones that they are going to work to promote our growth.
Right.
And it's very important. If we are going to talk about the adolescent and children, they need to sleep because this is where their growth hormone is going to work so they can grow. And sleep deprivation disrupts the biological rhythms. We have an internal clock, everybody. And this internal clock is very well synchronized. If we disturb this, we will have a lot of problems. For example, by having jet lag, by having, let's say, people on call and during night shifts, etc. We'll talk about that. But the real function of sleep is to promote the health, the growing of the body and organs, and to really promote the mental health.
And can I ask how many hours a night an adult should be sleeping?
In average, we have to sleep between 7 and 9 hours.
Okay.
But some people, very few, around 30% of people, they are very good and sleeping only 5 to 6 hours. They feel refreshed. Next morning they are on the go. They don't have any medical conditions or mental conditions, nothing. This is a small type of people that they do that. But most of the people, they need to sleep at least 7 to 9 hours, depending also on the age. For example, a young person will need 9 to 10 hours, right? An elderly person will need 6 to 7 hours.
Right.
So it depends on the age.
Okay, perfect. And can you explain some statistics in insomnias?
Yes. So if we can take in Canada as a model, 1 in 2 adults have trouble going to sleep or staying asleep. 1 in 2.
1 and 2.
1 in 5 adults do not find their sleep refreshing. So you have to go and find out why. In 1 in 3 adults have difficulty staying awake during waking hours. So this is the problem that can happen. It's a very common problem. So we have to tackle that really in a very systematic way. Why and how, and we will talk about that in details.
Dr. Iskandar, can you tell us what the symptoms of insomnia are?
Oh, sure. Insomnia, you don't sleep. Okay, I can, just before we go to the symptoms, just to say that we have 3 types of insomnia, if I can say that. We have insomnia is characterized by inadequate non-restorative sleep. So we have difficulties in initiating the sleep, in maintaining the sleep with frequent awakenings. So as we said, the impairments can be transient or chronic, right?
Right.
And for sure, the symptoms of insomnia, you are having a hard time falling asleep at night. For example, if I go to bed at 10 o'clock, it will take me around 20 minutes, 30 minutes maximum to fall asleep. More than 45 minutes, you have to be out of bed. It doesn't work. More than 1 hour, it means that there is a problem somewhere. Okay. Waking up during the night. How many times are we allowed to wake up during the night? Only once. More than that, so there is a problem. In psychiatry, we attribute the multiple awakening during the night is due to depressive symptoms. If I have to go back a little bit, we said if it takes me more than half an hour to fall asleep, this means that I have to look for an anxiety problem that is doing that or causing that. So the other type, is to wake up early. You wake up at 4 o'clock in the morning or 5, but you cannot go back to sleep. So this is another problem of insomnia. Feeling tired or sleeping during the day. This is the most common symptom that everybody is complaining. I didn't sleep last night, I cannot function today. Feeling cranky, depressed, anxious, having a hard time paying attention, focusing on tasks or remembering. Especially this you can see with people and workers on machines, with machines. So this can disturb if the patient or the person didn't sleep well and not concentrating well, he may do harm by using this machine. Making more errors, as we said, and more accidents. And the problem, okay, I didn't sleep last night, why I didn't sleep? Am I going to sleep tonight? I'm going to sleep tomorrow night, and all these worries comes, and it becomes a vicious circle that we have to correct.
I'm going to throw in a question in here, actually, because I feel like Insomnia, I personally am hearing more and more of it, but how often is it, or maybe is there an age range where it appears all of a sudden? And all of a sudden people start talking insomnia, people start even thinking of sleep problems. Is that something we can address?
Between, for sure, among adult patients, 18 to 65, for example, 40% report one symptom of insomnia 3 times a week, for example, 1% only. 10 to 13% meet criteria for an insomnia disorder. And we said the insomnia disorder means that the insomnia is there for more than 3 months. But women are 1.5 times more likely than men to suffer from insomnia. Older adults also have higher prevalence of insomnia. Aging is often accompanied by changes in sleep patterns, including disrupted sleep, frequent waking, and early waking that can lead to less sleep. So we have women more than men, elder patients or elder persons more than adults.
Why are women more susceptible at getting insomnia?
The most common is hormonal changes. So premenstrual, premenopausal, during pregnancy. So all these there are changes in hormones, and that's why women are considered more having insomnia. In my experience with women not sleeping, they don't sleep. They don't sleep because just to explain it a little bit in a funny way, if we take a married woman with children, she goes to bed. Yes, fine, she's going to bed, everything is okay, but there is a kind of video that's going to start to say, okay, what I'm going to do with the children tomorrow? Who is going to accompany the children? Who is going to make the lunches for the children? Who is going to bring them back? I'm going to see my mother, yes or no? All these questions. And we start a kind of a hamster that's going to start to run out, and she doesn't sleep. And they sleep a light sleep. They don't go into deep sleep. That's why any noise, any light, for example, or something, they wake up. And don't forget, when they are pregnant, they have a baby, the baby wakes up how many times during the night? So they have to be alert to the sound of the baby. That's why this is, I just explaining a little bit, in real life, this is what real life is for them not to sleep.
Can you tell us about the risk factors associated to insomnia?
Yes, we have to go a little bit slowly on that because we have 6 factors, major factors for insomnia. Let's start with the age and the gender. For sure, as we mentioned before, we mentioned that the females are more susceptible to have more insomnia. Elderly patients or elderly persons, they have difficulty with sleep, but this is because of the age. Before we go to the psychiatric causes, I'm going to go to the medical parts. It's very important to rule out any medical cause before we start to treat the insomnia. For example, patients with pain, chronic pain, they cannot control the pain, and that's why they don't sleep. Heart disease, respiratory disease, thyroid disorder, menopause, all these factors, they cause insomnia. So we have to rule it out before. There is something very important that I have to mention here, is what we call sleep apnea. Sleep apnea means that when you sleep, you are gasping for air, and as if your brain is telling you, hey, you don't give me enough oxygen, I need to wake you up or something. This is very important, and this is one of the causes that worsen the depression. So when we treat depression and we have a patient with sleep apnea, it will not succeed. because the sleep apnea is going to block whatever we are doing. So how we do that for the sleep apnea? We ask the partner, is your husband or your wife is snoring much? Is she gasping or he's gasping for air more than few seconds at night, and you notice that? So this is very important to rule out as a medical condition. Obesity also, when you are overweight, you will have hard time to get a good sleep. That's why it's one of the causes of the medical condition that can cause insomnia. We have a lifestyle also. People, they don't take care of that much. They smoke, they drink alcohol or drinks containing caffeine. And the rule is, do not drink tea or coffee. How many hours? Around 6 hours before you go to bed. For sure, so there are some people that they go to the gym just 1 hour before going to bed. This is not recommended because the exercise will waken you up, and make you more alert, more awake. So it doesn't help with your sleep. For sure, we mentioned before that the irregular schedule of your work, the night shift workers, the pilots, the policemen, nurses, all these kind of people, they have this problem of insomnia due to night shifts or irregular schedule in their work. If we talk about the social risk factor, we are talking about marital conditions, divorce, separation, death in the family can cause that, unemployment, poor working conditions, lower social status. All these factors can contribute to the insomnia that we have. So let's go to the sleep environment. Very important to remember that you have to sleep in a room where the temperature has to be very well adjusted, not hot, not warm, more on the cooler side. Lighting, some people would like to sleep without no light at all, completely, and people, they are disturbed and insomniac because there is a little bit of light coming from the window, for example. Noise, no noise. Interruptions, music, neighbors, all these kind of things. The partner's sleep habits, he's snoring much, I cannot sleep, and he moves a lot and he turns a lot, so all these factors. So the most important part is there are 3 S to use the bedroom. 3 S. What are the 3 S of the bedroom?
I wish I could tell you.
Sleep, sex, sickness. Okay? So you need your bedroom when you want to sleep, and you need your bed when you to have sex, and you need your bedroom when you are sick and you need to rest. Now we go to the psychiatric risk factor. For sure, when you are depressed, you don't feel like your sleep is disturbed. When you are anxious also, your sleep is disturbed. When you are abusing substances, cocaine versus marijuana or whatever, alcohol abuse also can disturb your sleep. Just one note here. People think if I take a good glass of wine, for example, before bed, I'm going to sleep well. This is wrong. It doesn't work this way. Mm-hmm. It will induce the sleep very quickly, but poor you are going to have more awakenings because of the alcohol. So people, they think, I'm going to drink till I got enough to sleep. Yeah, he's going to fall asleep, yes, but he's going to wake up many times during the night. For sure, we have some psychiatric illness that can cause insomnia, like mania or hypomania, a lot of stress. So all these factors really contribute to insomnia.
And these factors, they have to be addressed before treating insomnia.
Right.
Okay.
We have to look into that, and this is the most important part. When we do the history, we have to take a personal history of sleep, medical history, because before we say, okay, let's treat insomnia with whatever classical treatment. So we have to rule out any of the risk factors.
Great. Okay. And what are the causes of insomnia?
Yeah, for sure, the common causes of long-term insomnia, we said we have two types of insomnia, the short-term and the long-term. The short-term means an actual local stress happening. Somebody deceased, for example. We have circumstances in the family, at work, whatever, but it will be for a short term. I'm talking about the common causes of the long-term insomnia, which is more than 3 months. 3 months we cannot sleep every day, more than 3 days a week. So this affects you. So what are the causes? The causes here, we are talking about stress for sure. The concerns about work, stress about school, stress about health, money, family, can keep your mind active at night, making it hard to sleep. Stressful life events such as death, as we said, illness of a loved one, divorce, job loss, all these can lead to insomnia. Also, people are traveling a lot, so they have a jet lag. And this is very important because you are going to disturb your internal clock, known as circadian rhythms. Guides things such as your sleep-wake cycle, metabolism, and body temperature. So if we disturb the circadian rhythms, we can get some insomnia. Poor sleep habits it means that I don't respect my schedule of sleeping. We are going to talk about that in the sleep hygiene at the end, so it will give you a kind of a guideline how to sleep and how to respect your sleep also. And we have something called sleep rituals. If I miss one of the rituals, I'm not going to sleep. And I will give you some example at the end. So eating too much late evening also, you are not going to sleep. And some people, they like the spicy food. Spicy food can cause insomnia.
Really?
Yes, if you are not getting used to that, so you are going to have insomnia. But people who they eat every day spicy food, I have no problem with them because they are going to sleep. But the people who are not
used to
that,
foods.
they are not going to sleep, right? So also the people also, we have what we call heartburn. Sometimes we have the acid reflux. People, they get something of regurgitation of their food, and they feel all the acid coming out. So this is one of the causes also of insomnia, and we have to treat that. For sure, the most important part is to try to prevent the insomnia by having a good sleep habits, right? And we can mention few things here to help you to prevent the insomnia. How we do that? Keep the time you go to bed and the time you wake up at the same every day, including the weekends. People, they say, okay, tomorrow is Saturday, I'm not going to wake up. Believe me, you are going to wake up at the same hour that you are awakening every week, every day.
So the key is to stay consistent with your schedule.
Right.
Right.
Okay, people, they say, okay, Friday night I'm going to have a party and I'm not going to sleep until 3 o'clock. Yes, it's okay, but you are going to have hard time to sleep, to fall asleep. But if you don't repeat this every day, for sure you are going to be readjusted. But if you You are disturbing your sleep every day. One day you sleep at 10, one day you sleep at midnight, one day you sleep at 2. So this is a disturbance of the sleep,
Right.
and it will not prevent the insomnia for sure. We mentioned about the exercise, so stay active. Regular activity can lead to a good night's sleep, but not 1 hour before you go to bed you are at the gym. No. If you want to have the gym in the afternoon, you can go to have your gym in the afternoon, so you can go to bed making sure that you're going to sleep well. Limit the naps, or do not nap at all. This is a big problem and a big controversy, because people are saying, in North America, we don't nap. But if we go to Spain, if we go to Europe, they all nap till 2 o'clock. How come we don't?
Yeah, I thought it was like a healthy habit they were practicing over there.
In my opinion, yes. In my opinion, yes. But because of the work schedules, the money, you don't lose time. We have to gain the dollar. So that's why. But for sure, if you would like to have a nap to rest, this will be a great one. But don't sleep for 2 hours to nap. No.
So what's the time recommended?
The time recommended between 30 minutes to 45 minutes maximum.
Okay.
You are really going to be in very good shape to continue your afternoon and another work. This is what they do in Europe. They do double work, and they are very good. At 4 o'clock, they are all fresh and they are going back to work, and they go out from work at 8 o'clock or 9, and they start to eat at 9. And you see, it's different.
It's a different.
But for sure, if you would like to nap, not more than 30 to 45 minutes. Do not eat large meals or drink a lot of fluids before bed. Why? Because you are going to go to the washroom every now and then. Make your bedroom comfortable for sleep, and only use it for sex or sleep and sickness. This is what we said. And create a relaxing bedtime ritual, such as taking a warm bath, reacting, or listening to soft music. This will help you a lot to prevent not to fall into an insomnia pattern.
So, can you tell us now, because I think people are going to be really invested in this conversation and they might recognize themselves in what we're talking about. We want to know more of the real impact of insomnia.
For sure, insomnia is going to disturb many parts, many domains, if we can say. If I take the psychiatric domain, increased risk of depression and alcohol dependence. So this is a risk, an impact. For the health, for sure, increased fatigue, mental and physical. This will lead to hypertension, metabolic syndrome, coronary heart disease. People, they don't believe that insomnia can cause up to that. People, they think, oh, I'm not sleeping today, 3 days a week, it's okay. No, it's not okay, because it accumulates and the harm is getting more and more. In the performance, you go to work and you cannot concentrate, and you are dealing with the machines or something very delicate to manipulate, for sure your attention is lacked, concentration, productivity. And one thing that can happen is the absenteeism. Nobody goes to work. I cannot work today because of that. Or what we call presenteeism. You go to work, but you are not working. You are just in front of the computer, not doing anything. So all this are the impact of the insomnia. You didn't sleep well last night, but you are not going to perform anything during at your work. You are going to complain because you are going to see a doctor, to try to see a doctor, to see something to help you. For sure, this will increase the healthcare costs, for sure. The public safety, as we mentioned before, you can be having a car accidents or inability to drive or something like that. And in general, the quality of life is not as normal as possible.
And are these impacts of insomnia going to be shown in the short term or long term?
Long term.
Long term,
Long
okay.
term, yes. Especially if we go to the metabolic syndrome
Right.
and the cardiac problems. Yeah, but I don't have any cardiac problems. Yeah, we are going to have slowly a cardiac problem
Start slowly.
because of the impact of the insomnia on the long term, not on the short term. 3 months is the cutoff
Right.
of the insomnia between the chronic and the acute.
Right.
Yeah.
When we talk diet, because this must have an effect as well, it must affect our sleep habits and stuff. Can certain foods or drinks exacerbate insomnia symptoms?
Yes, for sure. There are some foods that keep you awake at night. Okay, on average, most people should stop drinking caffeine 4 to 6 hours before. When I say caffeine, it's not coffee. I mean all foods and drinks containing caffeine.
So like energy drinks.
Energy drinks, yeah, we have a lot now.
Right.
In the old days, like me, we didn't have all this. Coke, 7-Up, and this kind of thing. Yeah, but you need a drink that contains caffeine. Okay. Especially, there are some people who are very sensitive to this stimulant, and they have to avoid that. So we don't have any food causing insomnia. So we need them to sleep better without worrying about the food. So I come to the very important question about chocolate. Which kind of chocolate I can take? People, they say, hey, if I go to a seven-star hotel, they put some chocolates on my bed. Before I go to bed, I found chocolate. Yes, but they put a dark chocolate. They don't put milk chocolates. Milk chocolate contain more sugar. Dark chocolate, they don't contain high sugar. High sugar foods, before you go, you are not going to sleep. But dark chocolate, yes, it's okay. It's permitted. It's not going to affect your sleep. High glycemic index food, this is what we call all the foods containing high sugar. High sugar, so you have to avoid that before you sleep. Fatty foods means a Big Mac
Junk
at
food.
around 9. Yeah. Fast food, this is what we said. The alcohol drinks, we said we have to stop the alcohol. How many hours we said?
That's a test.
My guess is, was it 4 to 6?
4 to 6 hours. Yes.
That's right.
Yes.
Great.
I have to mention
passed the
something.
test.
I have to mention something here about the alcohol and the medication for sleep.
Okay.
People, they say, okay, I'm going to take my alcohol, drink whatever I need to drink, and I'm going to take my pill to sleep after.
Right. No.
No.
So there is a problem somewhere here. Right? Just to remind everybody, no, you don't do that. You want to drink? Fine, drink. 2 hours later, you are going to take your pill, if you have enough time.
Right.
But don't take the alcohol and then you go to bed and you take your sleeping pill.
No.
It's not going to work the way you want.
And nowadays, a lot of things are digitalized.
Yes.
By even myself at university, everything is online. There's no more paper. So, what are the impacts of technology on
Yeah.
humans?
I feel that technology plays a big role in the rising rates of insomnia. So let's take the electronic backlit devices like cell phones, tablets, readers, computers. They emit a short wavelength enriched light, what we call in our scientific language a blue light. So they have, all of them, they have blue light. Fluorescent light, LED light, they have also blue light. It has been shown that they reduce and delay the natural production of melatonin in the evening and decrease the feeling of sleepiness. Just a little bit of explanation here. We are talking about melatonin. The normal melatonin is secreted by the pineal gland in the middle of our brain. Okay, at 10 o'clock, around 10 o'clock, if we measure the melatonin, it's going on the rise. It goes up. That's why some people in front of their TV at 10 o'clock, they sleep a little bit, they start to sleep because the melatonin is getting higher and higher. And it decreases in the morning around 6 o'clock. If I use my iPad, I am going to suppress the release of the melatonin, so I am not going to sleep. So I am disturbing the release of the melatonin. Children are particularly vulnerable to sleep problems stemming from these electronic devices that emit the blue light. Numerous studies, we have a lot of studies, lot of talks, lot of information about that, established a link between the using the device with screens before bed and increase in the sleep latency or the amount of time it takes someone to fall asleep. So, most of the adolescents, they take their phones with them and then they don't sleep. Next morning, they are tired, don't concentrate, they are not them. The mothers and the parents are really upset because they bring the adolescent to us to say, hey, give them something to sleep. No, just remove the iPad, remove the iPhone, at least 30 minutes before they go to bed. If it's more, it's better. But if you leave them with the iPad and the iPhone before they go to bed, for sure they are not going to fall asleep. So this is very important to avoid the cell phones and iPads, the blue light anyway, before you go to bed. It will cause more insomnia.
Do blue light glasses help? Because I know sometimes when we go to the optometrist, they recommend blue light glasses. Does that help in this case, or
you have glasses that prevent the blue light,
right?
Mm-hmm. And you have also your iPhone can have a screen. The blue light screen.
Right.
Yes, if you have that, you are preventing the blue light to go to your eyes.
But
yes.
Is this really the factor that will change the effect it has on a person? Like, say I take the measures with the screen.
It's a behavior, The adolescents are attached to their phones, to the iPads, as if they miss it, they are going to be dead or something.
Exactly.
They are very dependent on this. So we are not talking just the blue light. No, we are talking about the dependence on this technology.
That's right.
Yeah. Yes, and this is very bad because the next morning when you go to school, you look at the students, they are half asleep. Mm-hmm. They are not alert, they are not ready to go and learn because of that. So the insomnia is very hard for children for sure. And as we said, for children, they have to sleep because the growth hormone is working during the night.
Mm-hmm. Absolutely. I guess in the next segment, we're going to talk about sleep hygiene and why it's so important when we talk cognitive behavioral therapy specifically for insomnia. So if you can guide us on this.
Yeah, the sleep hygiene, if everybody would like to have the guideline for sleep hygiene, you have a lot on different sites. So you can go there. We mentioned few guidelines for the sleep hygiene. For example, about the nap, about the caffeine, the nicotine, the alcohol, the lights in the bedroom, the exercise 3 hours before, the heavy meals to avoid. The bedroom has to be really in a good temperature, not too cold. We have to avoid to look at the clock. People, they say, okay, I wake up every hour on the hour and I look at the clock. A very common complaint that we have. Why do you look at the clock? I woke up and I look at the clock and say, okay, it's 2 o'clock. And then at 3 o'clock, she's awake again. So you see, this is not a good thing. So put the clock aside so you can have at least, you don't correlate the time with your insomnia, so to avoid that. We mentioned about not to drink much fluids before. Avoid the iPads and the iPhones at least 30 minutes. 1 hour it would be better, for sure. And I mentioned at the beginning about a ritual. What is a ritual? What is a ritual that everybody has before they go to bed? I will tell you about that because people, when they miss one action between ready to go to bed and in bed, if they miss something, they are not going to sleep. So this is what we call a ritual. I'll give you an example of one of my patients. He told me that. He said, look, usually when I am ready to go to bed, I put my pajama on, I go and wash my teeth and everything, go to the washroom, ready, and I bring with me a cup of water, a glass of water with him. Okay. And he starts to bring his book so he can read a little bit or listen to music and go to sleep. One day, he did all that except having the glass of water with him. He didn't. He forgot. So he couldn't sleep. Why? The glass of water, because he forgot that. So we have some rituals, some behavior that we do to feel comfortable that we have to go to bed comfortable. So if we miss something, just remember that you missed one of the actions that you usually do about the rituals of insomnia. Yes. So people are coming and say, look, I don't need medication, I'm fed up with medication, can you give me something natural to sleep with? Yes, we can do that, but for sure if you have a medical problem, as we said before, we have to rule out all these causes. This will help you to sleep without medication for sure. For example, I will mention melatonin, and everybody knows about melatonin, about 5 to 10 milligrams, 2 hours before you go to bed. The melatonin, as we mentioned, is a hormone present in our body that increases to help us to start the sleep process. So if we take it 2 hours before. Valerian also, very infusions or CBD oil, we can use that. Glycine, chamomile, magnesium. Magnesium is now a la mode, as everybody knows that. 300 to 400 milligram per day will help you with sleep without taking medication for sleep.
So, Dr. Iskandar, how can someone manage their insomnia?
As we mentioned before, to follow the sleep hygiene and to respect the sleep hygiene, right? I give you some cues about that. To avoid the drinks, to avoid the food, to avoid the blue light, etc., etc. But when somebody has a chronic insomnia and comes to us as physicians to help, what we do is we take a good sleep history. What time do you go to bed and get up? Do you wake a lot during the night? Do you have a medical problem? We look for the medical problem. We look for it to exclude it. What started you to have insomnia? How come you got insomnia? What is the factor that helped to start insomnia? Were you you having a stress, you had a loss or something like that? So we take a thorough history. We take a medical history. We have a very nice questionnaire here that covers 5 issues about insomnia: how he's sleeping, how he's falling asleep, what else did you try to fall asleep, etc. Is he snoring? Is not snoring? This kind of things. Is there any psychiatric disorder? Is there any? Is he a worker, or your sleep schedule is irregular? Something also that can happen, and people they don't mention, is the restless leg syndrome. Are you having a restless leg? So we ask the wife or we ask the husband if the movement of the legs are disturbing the partner during the night. So this is one questionnaire, very easy to do with the patients, and this will confirm the diagnosis of our insomnia. We have also unusual behaviors or movement during the sleep, as we said. This is the restless leg kind. The snoring, we mentioned that. Is the patient is having hard time staying awake during the day. So all this information we gather, and we rule out the medical condition, the other factors, and we see what we can do. One thing that I mentioned before is the sleep apnea. We can manage that because it's very easy to manage the sleep apnea. We give the patient a module that he takes at home. It will record all the sleep pattern at home. And then we analyze whatever the machine is telling us when he comes back. If we need to put him in the sleep lab, we'll do that. If not, it will confirm that he has a sleep apnea and we need a CPAP for that. Something else that we do is the behavioral therapy, very important. And we have now psychologists trained in behavioral therapy for insomnia, not for depression or anxiety, but for insomnia. For sure, they will help you with the sleep hygiene, to solve the problems before you go to bed, to try to help you to analyze everything, every steps you take before you go to bed. And before all this, I didn't speak about medication yet, because we did go through a lot of investigation before we go to medication. So we mentioned the sleep hygiene, the physical activity, the meals, the CBT. It can help. CBT is the cognitive behavioral therapy for insomnia. And if we are obliged to prescribe something, we can give some medication to help. People, they go over the counter, by the way, and they say they buy sleep ease. So everybody is asking, what the hell is sleep ease? Sleep ease is just an antihistaminic called Benadryl, not more. They do that, and some people, they will sleep better with that. There is no problem with it. But this is not the solution for their insomnia if there is other factors and other risk factors that we mentioned before.
Right.
Yeah. So all the over-the-counter remedies may provide relief, but it's not a good treatment for insomnia. For sure, I'm ruling out any medical condition, any asthma. By the way, the people who are asthmatic, for example, they take the pumps 1 hour before they go to bed, but they are not going to sleep. All the pumps are stimulant,
Right.
so they don't help to sleep. If you want to take your pumps for your asthma, just try after supper to take the pumps so you'll be ready to go to bed. If not, you are not going to be asleep. So the pain, as I mentioned, we cannot deal with the pain as psychiatry, but we asked our colleagues in the pain clinics to help us with that. There are some hypnotics that they are very good. They will help you to induce the sleep, and they will leave you after 4 hours. Just induction of the sleep, help you to fall asleep in the half an hour, like we said before. So we have 3 of them available actually. They help a lot. Some of them also, they help you to sleep more than 6 hours, which is not bad. So this is what we do with the insomnia. After ruling out any medical condition, any social condition and life condition, psychiatric condition. If we treat the psychiatric condition with an antidepressant or something, the sleep is going to be established very well and no problem with that. So, if we would like to conclude and to remind you of what we said,
Yes.
what's to blame to our sleep problems? Who to blame? I can blame the medication that you are taking, as mentioned, the pumps and the stimulants,
Right.
any stimulants. The people who are attention deficit patients who are taking stimulants, if they take it after 6, forget it, they are not going to sleep. This sleep disorders like the sleep apnea, health condition we mentioned, chronic diabetes, heart disease. Sometimes the cancer patient, they suffer insomnia because of the pain, because of they are uncomfortable. Mental health condition, we mentioned the depression, the anxiety, PTSD or something else. We mentioned the caffeine and alcohol and stimulants. The age, we mentioned elder people, patients and females. The blue light, we did talk about that. The schedule changes, your every day you have a different schedule for your work. Any stress around you causing that, and the poor sleep hygiene. I wish you a good sleep.
And to conclude on that, thank you so much, Dr.
You're very welcome.
Iskandar,
Thank you.
for your time and generosity with all of the information. It was very insightful. I think people who may be struggling with insomnia or feel like you're tapping into that,
Definitely learned a few things today from this segment.
and there's a lot of healthy practices to adopt that are tangible, it's realistic, and if you have any questions, feel free to write to us as well. We can get more information for you. So this was our chat with Dr. Iskandar on insomnia, and tune in to next episode.
And have a good sleep.
Yes.